Just want to say hi as people are coming in. Welcome back to those of you who were here last week, and welcome to the ones that are new this week. My name is Jackie LaCava. I'm an acupuncturist, and I work with Unite for Her. And let's do acupressure today. This is week 2. Last week, I asked for some questions from the chat, things that people still wanted to know about after our last meeting. One of the big ones, which I'm really glad somebody asked, is there something else I can use to apply pressure? Yes, I hand these out to patients. The eraser on the end is good when we're doing acupressure. And for those of you that are new, you'll understand when I get to how you do acupressure in an area. But if you can't reach an area that we're working on, you can use the end of a pencil eraser. And I have some people who get like the little knobby one erasers that stick on the end. It's helpful, makes it a little broader, a little bit softer. But the length of it lets you get to like your feet if you can't bend down all the way, or some points on the back, things like that. So pencils with an eraser on the end. Is it okay to use your thumb rather than index finger for more pressure? Absolutely. My only caveat with patients is do not bruise yourself. So especially when you're undergoing treatment, sometimes you become an easy bruiser. Don't feel like the pressure has to be so much that it's painful. So you can absolutely use your thumb instead of your index finger, but do not press too hard. And then there were some questions about a couple of the points in the protocol. Don't worry. The way I set up this series is that we stick with the same group of points generally, and then I subtract and add depending on what we're treating. So we will still review some of the points from last week this week, which I think is helpful. All right. Just like last week, integrating acupuncture or acupressure into your current care plan is whenever you can, preferably once a day. Some people it's better in the evening, some people it's better in the morning. You do you, but once a day where you have a second to just sit and press on a couple points is just fine. And then today I'd like to focus on nausea. Last week was a general protocol, which I think is on my next slide. I'll flip to it for just a second. Out of order. So last week we focused on acupressure for cancer treatment related fatigue. Great base acupressure point protocol for the entire breadth of your treatment. Today we're going to remove a couple of the points and then add in one point that research has shown is very helpful for chemotherapy-induced nausea. How we do acupressure. So again, as I said last week, find a quiet place, a comfortable position. It can be seated. I'm at a desk. It can be sitting on the floor if that's more comfortable. It could be lying on your back in your bed or in a recliner where you can lift your legs up and move your arms up as you need to. You just need to be able to comfortably reach all the points. Pressure should be applied for 1 to 2 minutes per point. So as we go through these points, I will be holding them. You do one at a time. So we'll do one side and then the other side. Doesn't matter if you do left first, right first, whatever is comfortable. And you're applying that pressure for 1 to 2 minutes per point. Do not feel like you need to massage the points or tap the points. There are some points where I might explain a direction of pressure, like pericardium 6 will direct this way on the channel. So there might be some I direct pressure, but for the most part, neutral position is just consistent pressure, thumb, finger, can use a pencil eraser. 1 to 2 minutes per point. And as I said, treatments are done once per day, every day. Try not to lose contact when you're doing acupressure. Again, not looking for tapping, just looking for steady pressure. Okay, so the new point today is pericardium 6. So we're removing 2 of the points from yesterday, one towards the ankle, one on the wrist, and we are adding instead pericardium 6. And before I get into the protocol, I want to say, as you're going through this, if you're thinking of anything that you're interested in using acupressure to treat, just like last week, put it in the chat. Rachel's been wonderful about compiling them and sending them to me. And then that helps me direct the rest of the things that we go over for the entirety of the 6 weeks. Okay, I'm going to get into it. Let's start as we did last time. So seated comfortably. We're going to do yin tong first. So this point is this one right here. You're going to, you can take one finger, you can take 2. It's whatever's more comfortable for you. Thumbs, you could do thumbs this way. Another option would be this, if you don't want to feel like your fingers on the point. I'm going to do this. Your eyebrows are right here. You're going right in the middle. So it makes like a little triangle. You're going right in the middle. And then you're doing equal pressure. And we're going to hold this for a couple minutes. And I like to start with this one first because it's very anchoring and centering and grounding. And while you're holding it, just a reminder to, if you can, keep your feet, if you're in a seated position, keep your feet flat on the ground, nice and grounded, back relaxed, shoulders relaxed, palm open, relaxed. If you tend to be a jaw clencher, just opening and closing your jaw, reminding it that it can relax. And as I sit, I always have to remind myself to breathe. So breathe as you're pushing the points. Okay. From yin tong, we're going to move to the back of the head. And from last week to this week, I chose a different point, a different picture. So over here, you're going to go in that little nook behind your ear. You're going to feel a bone there. You're going to roll over that bone with your finger, and there's a little nook, tends to be tender. And then you're going to, made my neck pop last week. You're going to drag your finger backwards towards your neck, posterior. So you're going in the nook. You're going back over that triangular bone, and then you're dragging it back, just gently. You tend to hold it for a little while, and then drag it back. It's usually tender, especially if you have neck tension or you tend to get headaches. Technically, this is one of those points where it's easy to feel like you can press both sides at once, but that's a little too much for your body at once. So just do one at a time. I have to remind myself that too. And as you're sitting and pressing, remembering to breathe, just like the last point. And then if your mind is going in a million directions, just try to bring it back, focusing on the point, on your breath, or on your feet on the ground. And then bringing it back. Okay, I'm going to switch to the other side. Just like last time, you're going to the nook, over the mastoid process, and then right where it's tender. And then you're dragging it back as it makes sense. It's usually a little tender as you're going over the mastoid, that little bone back there. And you can bring it down a little bit if you want to, like in a little arc. And just a reminder, this point is called On Me On. It means peaceful mind, peaceful sleep. We use it a lot for insomnia or that lovely thing where you can't get to sleep or you're waking up 1 to 3 in the morning and you can't get back to sleep. And if that's happening, you could always do this acupressure protocol or the one from last week when you're waking up in the middle of the night. And if you're taking, so thumb might be too much pressure. It's up to you. You could take your thumb and then eraser wise, could take a pencil eraser. I wouldn't drag it though. I would just put it on the point.
We did just have a question in the chat asking if you can do both sides at the same time.
So there are some points that you can get to easily at the same time. I feel like with acupuncture, we treat bilaterally. Acupressure, it's a little bit too much to be doing both at the same time. You tend to, like if I'm pressing here, then my scapulas are both going back. I can feel like your body has to hold more versus one at a time. You can lean into it a little bit. You still feel the relax on the one side. It's a little better for acupressure to be unilateral. So I would say, yes, you can, but traditionally, acupressure protocol is unilateral, one at a time. And you can pick whether you start with the left side, whether you start with the right side. Okay. So, yin tong, on me on, both sides. Next, we're going to move to feet. And I do this for nausea because I know last week, traditionally with acupressure protocol, you start at the top, you do one side, and you work your way down the body. But with nausea, when you're going down to get to some of the feet points, you're compressing your belly. So I would rather have you end not compressed, pressing the point that's for nausea, than to have you press the point for nausea and then immediately compress your belly down, your diaphragm and everything down to touch a foot point. So that's why I'm doing that out of order if that question comes up. So liver 3 is right here. You're going between your big toe and your second toe, and there's like a little triangle. Let's see if I can tilt this down. This is where a pencil is helpful. You come up and there's a little nook in there. It's like a little trying to do it in there. A little triangle in here. And you're following the triangle up to where it's tender. And then you're pressing. And I will say this is either of the pencils, but that way you can, I don't know if you can see that. You can move it this way. And then just press like this. You could even, with a pencil, press down while seated, not that far, which I think is nice. All right, I'm going to start on the right side. Join some of you who have already started. Now, I naturally use my thumb because I'm bringing one leg up and it's just more comfortable to grab the foot and do that. So you're more than welcome to do that if pressing with your index finger doesn't feel as comfortable and natural. And then we hold this. This point tends to have a little bit of an achy muscle feeling, maybe a little bit of tingly if you have some neuropathy. So don't feel like you have to overpress with it. Nice and gentle. And if you have, I have lower leg lymphedema, but if you have lymphedema, just watch that you're not pressing too hard, that you're pitting it too much. I've also had patients where they'll wear their compression when they're doing acupressure. Which actually, this question hasn't come up, but yes, if you wear compression garments, I should be wearing mine. It's so hot out today. You can do the acupressure right over the compression. It's fine. I'm going to switch sides. And again, when you're pressing, The other foot should be on the ground. You want to remember to breathe. I do find that this one, if you're doing this in bed, you can lie on your back and just bring the foot up. And liver 3, along with, which maybe I should do insomnia, but liver 3 along with the first 2, it's good for helping with sleep.
We did have another question on Facebook that was, should I be pressing just the top or also the bottom of the foot?
Oh, good question. So the point on the top is liver 3. So that's what we're pressing, is just the top, even though I'm grabbing it. There is a point underneath that is kidney 1, which is also a really grounding point, but no, we do not need to press that one as well. When I'm grabbing this way, I'm gently holding here, and then I'm pressing here. It's a good question. Okay. I'm going to switch points. So now back to the wrist. So coming up, the picture has it down like this, and then you're coming up here. So it is 2 fingers. So you're going to your wrist crease like that, and then you're going 2 finger breaths down right in the center. And then you're pressing. There's a couple of tendons there. And this one tends to feel, it's kind of like liver 3. It tends to feel a little achy, a little nervy. Don't press too hard. I'm going to use my index finger. And I saw that question about benefiting from less than once a day. And I would say research is going to be different than how we use it in real life. So the research article that I posted in the QR code would say that they had subjects complete acupressure daily for many weeks. Now, I have patients who the only time they're sitting and they can do acupressure is, when they're getting an infusion. So I think for nausea in particular, it's one of those things that you can just use more or less as you need it. Meaning you might use it more frequently when you're nauseous and not at all when you aren't, if that makes sense. Now I'm going to switch in just a minute. And you can also, I'm holding it like here for the point location. If I was doing it on myself at home, I would probably be holding it like this. So loose here, and then using my thumb like this. And then as far as movement, it's hard to show. I'll show you my armpit, but I guess you've seen my feet already today. So if I'm going down like that, so you're moving it away from the wrist. And then let's switch to the other side. So wrist crease, 2 fingers down, finding it right in the center. And then you're massaging it this way, essentially, just gently. And sometimes, so with pericardium 6 in particular, I'm visualizing my esophagus and this area of the body moving down. Like all that acid reflux, all that nausea and indigestion, all that swirling feeling. I'm imagining that the channel, which the pericardium channel, starts right in the breast and then comes down, and then there's a root that comes down into here. So we're visualizing the channel going down. And then I think when we finish this last point, we'll have a moment for any questions. And Rachel, feel free to chime in if you have any answers to some of the ones that are cropping up. Okay. We've got a couple minutes. Any questions for me? Let me move.
Is there a point? I experience neuropathy mostly in the soles of my feet.
Mm-hmm.
Is there a point to help alleviate that? It does tingle up my legs sometimes, but the soles of my feet and my toes.
Yeah, that's good. Let me start my post-it list. Certainly, we can do some neuropathy points. And I think it's helpful to have some for lower neuropathy. And then a lot of people get that tingly right in like the fingers as well.
Mm-hmm.
Toes, yes, absolutely.
Toes,
yes,
the
we can
soles.
work on that.
Thank you.
Yes, I will say with neuropathy, it's one of those things that acupuncture, electroacupuncture, things like that is going to be maybe more effective. Sometimes moxa is, but acupressure is good for that in between with treatment.
Okay. So electro acupuncture, I've not heard of that before.
If you look at, and I think this is a larger breadth than this conversation,
Okay.
a lot of the research with neuropathy and acupuncture and peripheral neuropathy from chemotherapy is going to use acupuncture with microcurrent stimulation. So adding like a TENS unit almost to needles.
Mm-hmm.
But either way, it's more in the acupuncture side with the acupressure versus just acupressure.
Okay. Thank you.
Mm-hmm. Got one more minute. Let me see if I can open. If I open the chat, if it'll too much. Yeah, if there's anything.
And there's a couple more specific ones about different points for different pain in the body. I can share all of this chat with you.
That
And
sounds
we
good
can
to
maybe
me.
go over it next week or answer
Yes.
directly.
Yep. Last week you sent me a summary and then I was able to filter through and then created nausea for today. So maybe neuropathy next week. And then we'll go from there.